From today, eligible seniors who are at least 80 years old can walk into any vaccination centre or selected clinic to receive their second COVID-19 booster shot. They may also book an appointment online if they prefer. The Health Ministry has said, though, that getting a second booster will not result in a change in the vaccination status for those who are eligible but choose not to receive the shot. You can find a full list of vaccination centres and participating polyclinics and clinics at vaccine.gov.sg. A recent Israel study found that a second booster's effectiveness against infection wanes after 4 weeks. Professor Dale Fisher joins me now. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Professor. In light of this finding from the Israeli study, Professor, why should seniors still get the second booster?
So thanks for having me back, Harrianta. So firstly, vaccine efficacy waning is not really a binary thing. It's not that you're immune one day and non-immune the next. It's more of a gradual easing. So what we see is with this sort of gradual continuous occurrence is that, yeah, certainly some people are getting mild or asymptomatic illness in those weeks after the vaccine. But what really matters is the severe disease. And what this Israeli study shows is when they compared people who had had the fourth dose or the second booster and compared those to that were at least 4 months out from their third dose but hadn't had a booster, then it's the people that had the fourth dose had an advantage, particularly if they were over 80. There was also some benefit in the over 70s, but not so much the over 60s. So it was very age-related that this waning was happening, and it is happening in severe disease. So I don't think people should focus too much on the vaccine. We've been saying this for a long time. The vaccine's not very good at preventing transmission. It doesn't last long, but it is very good at stopping severe disease. Now we need to learn how often we need the booster to maintain that benefit. I think it's going to be a different range, a different interval between the boosters, depending on how old you are, and maybe even younger people won't need it. Maybe they just maintain their protection. But we're going to learn a lot more, particularly out of Israel, who were the first to start all this. We're going to learn a lot over the next few years about how often we need it.
So, Professor, based on what you've just said, is it then becoming more likely that it will be a yearly shot, like the influenza jab, as opposed to, say, us seeing an end to the national COVID-19 vaccination program?
Yeah, I don't think we'll ever see an end to COVID-19 vaccination. But as I mentioned, we're still learning. I think one thing we're learning is that we still should be trying to get better vaccines, things that can be more easily given or administered, maybe nasal or oral, or better at preventing transmission or longer lasting. These types of things are still areas of research that I think we should continue to pursue. But the vaccines we have are still very good. Can we wait a year? Well, this study has just shown really that 70 and 80-year-olds can't wait a year. So maybe that'll be 6 months, but maybe it could be a year for other age groups. Or as I said, maybe younger people, they'll have enough memory in their B cells and their T cells to be able to prevent any severe disease. So as I say, I think it'll vary depending on the age, but we're going to learn a lot over the next months and years about this.
Professor, just before you go, separately, we've been focusing quite a bit on COVID-19 vaccination for the past year. What about the yearly flu shot? Just earlier today, Health Minister Ong Ye Kung also posted on social media that MOH is offering vaccination to all the staff and the minister as well. Your thoughts on the flu? Is that another cause of concern?
Yeah, I'm very pleased this is coming into the conversation, because the severity of COVID now is similar to the severity of flu. So we can't just forget about everything else. Now, you've got to remember pre-pandemic, about 20% of all deaths in Singapore were from pneumonia, and most of those pneumonias would be influenza or pneumococcal bacteria. And they're both vaccine preventable diseases, and they're available on the Singapore advisories and schedules. So you can work out if you're either in the younger age group for flu or the older age group for the other two vaccines. And people should really be having it. The reason we're particularly vulnerable at the moment is because all these masks and stopping gatherings and things like that, they prevent all respiratory illness. So there's been hardly any flu in Singapore for the last 2 years. And when there's no circulating influenza, then then our immunity to flu also wanes. And if people haven't been getting vaccinated, often because there's not much flu around, then again, that vulnerability has come up. Singapore gets two peaks in its influenza. It's obviously all year round, but particularly mid-year, so June, July, we're coming up to that. And around Christmas time, December, January is the other peak. So I'd really urge people to not forget about other vaccine preventable diseases as we go to business as usual. COVID will settle into business as usual, but we need to attend to the other vaccination needs.